Okay, we're going to go ahead and get started. I'm Joy Hogue. I'm with Families as Allies, and we're one of the partners on this project. And I know we and all of the other partners are delighted you're here, and you'll be hearing more from all the different groups that are involved today. I just want to go over a few housekeeping things. One is we are recording this meeting, and we do plan to be able to share it with others who weren't able to be here today, and also so that you can go back and look at it. So that does mean that remarks will be recorded if you share things during the group. So we just want you to be aware of that. And if there are things you share that you'd rather not be in the recording, you can just send me a message or let me know that's your preference, and we will edit those out. We do ask, we really want to hear from you during this. So we do ask that during the presentation, please share your thoughts with us, and you can do that in the chat feature. And probably everybody's familiar with this, but I'm going to go over it. If you want to share with everyone, make sure that you click on the everyone button so that we can all see what you have want to share. If you want to share with just the panelists, you can do that in a couple of ways. One is going to chat and sharing with just the host, and that's me, and then the panelists, who are the people who will be sharing with you today. Or you also see that Q&A feature at the bottom. You can use that, and that goes just to the hosts and panelists. And typically what we do with those remarks is we share them without saying who said it. But if it's something that you don't want shared with the group, you can also put that in there. And if there's families on here who have, if there's specific issues that come up that you want more information about, but you'd rather not share that in the group, you can always send me a message, and we will be very happy to get with you either after this meeting or at a different to give you some information about how to get in touch with us so we can make sure we respond to you and support you as families. And I think those are all of our housekeeping rules. I'm going to double check with the panelists to see if I forgot anything. Okay. Well, I am absolutely delighted to turn this over to our first presenter, who will be sharing some of these slides with us. It's Dr. Susan Buttress, and I think most of us probably know her and know her work well, but she is one of the co-PIs for Mississippi Thrive, and she'll be telling you a little bit more about that in this project. So welcome, and I'll turn it over to you, Dr. Buttress.
Thanks so much, Joy. And first of all, I really do want to thank all of you who took this hour of your lunch on a Friday to join us. And also I want to thank so very much our partners, Joy and Families as Allies, and certainly Mississippi Families for Kids, in getting this survey done and getting the information out. And a special shout out to Callie Poole, who has done a lot of very hard work trying to get us all pulled together for this. So today you're going to hear in the next 55 minutes the results of the Childhood Network Mapping Partner Survey. And I just want to give you a general overview. So you can go to the next slide. So as I said, this event is brought to you by Families as Allies, Mississippi Families for Kids, and of course our Mississippi Thrive Child Health and Development Project that many of you know as Mississippi Thrive. It's a project that has been funded over the last 5 years by HRSA, that's Health Resources and Services Administration. And it is a large project, and the overall goal is to improve the child health and development for children birth to 5. Obviously, there are lots of good reasons to focus on young children, because that is the early part of their development. That's when the brain is growing most rapidly. And so we feel like this is a big focus. The Mississippi Thrive is a partnership between the University of Mississippi Medical Center, our Center for the Advancement of Youth, and the Social Science Research Center at Mississippi State University. I'm the PI at UMMC, and Connie Baird Thomas and Heather Hanna are co-PIs at SSRC. We have worked with many different groups and we are very excited. We hope you've heard from us. And I just want to throw out that we do have a website. If you haven't been on it, please go to it. There's a lot of good information there. It's Mississippi Thrive, rideoutmississippi.com. So you can go to the next slide. So today what you're going to hear is just some basic background of why we did it, the results, and then the conclusions. And then you will hear from a parent and their perspective and want to have a discussion. And we want you to stay on until the very end because we have a raffle and we're excited. There's some really good prizes in the raffle. So stay tuned. Thanks everybody again for being here. And I'm going to turn it over to Dr. Thomas, Connie Baird Thomas. She is Professor of Research at the Social Science Research Center. And as I already said, co-PI on this great project. So Connie, take it away.
Thank you, Susan. So I just want to give you some background on the survey. The survey was conducted by Visible Network Labs for Mississippi Thrive and Mississippi Families for Kids. And they used what's called the partner tool, which allows you to track and visualize your community partnerships over time and demonstrate your shared impact on stakeholders. So we wanted to measure how early childhood stakeholders across the state are working together and with the goal of finding more effective and strategic ways to collaborate. So this was a web-based survey that was conducted in August of 2021, and it was sent out to 105 early childhood leaders in the state. And we had a really good response rate. We were really excited. We had a 68% response rate, which is really good. And of those, the majority of respondents were from nonprofit organizations, and that was 41%. So I want to turn it over to my colleague, Dr. Heather Hanna, and she's going to go over some of the results of the survey. And Heather is also a co-PI of the Mississippi Thrive Project, and she's a research professor at Mississippi State.
Thank you, Connie. So the survey participants were asked what they contribute to the early childhood system. And they responded that their top contributions included networking opportunities, 75% said that, advocacy, 68%, facilitation or facilitation or leadership, 65%, training or capacity building, 65%, formal relationships with state agencies, 62%, relationships with community-based programs, 59%, knowledge of community resources, 59%, and relationships with policymakers, 58%. Next slide. So when stakeholders were asked how successful they believe the Mississippi early childhood system has been in meeting families' needs, most felt that it has been slightly to moderately successful. No respondents felt that it has been very successful, though only 13% said it was not successful. Next slide. So stakeholders were asked what the most critical goals of the early childhood system are, and also which are most likely to be achieved. And fortunately, some of the goals that were identified as most critical were also identified as most likely to be achieved. And these included advancing collaboration and collective impact among partners, improving school readiness, and improving referral and linkage for families. While improving child health outcomes, reducing health disparities, changing policies, and advancing political will for early childhood were noted as critical goals, respondents were less likely to state that these goals were among the most achievable. Next slide. So likewise, respondents reported a lack of funding and political will as the top obstacles to achieving early childhood goals in Mississippi, and other challenges included family engagement, competition for scarce resources, bureaucracy, competing priorities of partners, difficulty bringing stakeholders together, and a lack of accessible programs. So next, my esteemed colleague and project manager from the SSRC, Callie Poole, will tell you about some of the qualitative analyses from the survey.
Thank y'all so much. Yes, so the survey answers that we've gone over so far, most of those have been multiple choice, but we did have 2 open-ended questions. And one was just, what were stakeholders' perceptions from working with families of what they need most in regard to the early childhood system? And so you can see these 3 key themes that emerged from that data. Overall, stakeholders felt that families really need easy, equitable access to affordable, high quality early health and education services. The most common answer was that first one you see, access to an affordable, high quality early education system. And some items that were specified by several participants included professionals who are well trained in early childhood development, as well as access to pre-K for all students in Mississippi. And the answers for the next most common item was, which was early access to healthcare, also included many participants who stated that those healthcare providers need thorough training in early brain development science, and we need those in all areas of the state. And some examples that really came across several times about that early healthcare included preventative care, diagnostic services, early intervention, and mental health supports, as well as regular early developmental screenings that are partnered with appropriate referral and linkage services. And another answer that came up again and again was that those diagnostic and therapeutic supports need to be adequately covered by health insurance, including Medicaid. And another really common answer was that we need an early childhood system that is coordinated and easy to navigate. So that would mean families can easily obtain information on how to access beneficial and relevant resources. And something else that was repeated was that this needs to happen in a timely fashion with quick responses from providers. And equity was another big piece of this question. So equitable access to resources, and participants brought up these need to be quality global services that families can access no matter what their income levels are, where they live in the state, or what disabilities family members may have. A lot of emphasis was also placed on resources that provide socioeconomic support. And these type of supports need to be easily accessible for families who could benefit from them the most. And then another really common answer was educational and support opportunities for parents about resources, parent-child interaction skills, prenatal health education, and opportunities for networking with other families. And some specifics that were brought up repeatedly were how important it is for agencies and organizations to value parents as partners, to empower parents to make decisions for their children, to listen to parents before giving advice without judgment, and setting the tone for two-way communication between parents and organizations. And we'll go to the next slide to look at our other open-ended question that we asked stakeholders. And a lot of these answers were very similar to what they perceive families' needs to be. So what they thought success in our early childhood system could look like includes high quality early care and education services, as well as all of Mississippi's early childhood professionals working together to improve the health and happiness of all of Mississippi's children and families. So that most common answer again was the comprehensive, affordable, quality early childhood education. And again, it was emphasized that the teachers need to be well-versed in developmentally appropriate practices. And it was brought up by several respondents that this would lead to improved school readiness, which was one of those most critical goals identified. And then the second most common answer was that efficient, comprehensive, accessible, and navigable system. And many words kind of shone through again and again in answers. And some of those that describe the system were well coordinated, collaborative, cohesive, non-competitive, and family centered. And again, there was a lot of emphasis on how well trained the health and education partners were in early childhood development. Collaboration was also really emphasized. A lot of folks talked about a common mission and a common practice of providing a broad, diverse array of services and resources. And again, equity was brought up over and over so that the resources would be available to all families and children in the state, regardless of their geographic location, race, ethnicity, income, health, or any disabilities. And then the last one, so many folks just felt that we would recognize success because our children and families would be thriving and their health and happiness would be increased. On the next slide, we asked folks about how they trust and value their partners in the early childhood sector. And for those of y'all who took the survey, you know that this part was very extensive. And again, we thank you all for taking so much time to complete the survey, because what it did was ask you to identify, as many of your partners as you could. And then it really asked about your trust and value with each of those partners. So what you're seeing here is just the consolidation, overall among everyone who participated. So the way that they scored trust was these first three columns you see here. So they asked folks, what is the mission congruence among partners? How open are your partners to discussion and how reliable are they? And so those three items made up the trust score, and our overall trust score was 3.46. And just to give you some context, 4 is the highest possible score. And so the group who conducted this survey had let us know that they consider any score over 3 to be high. And so you can see that we did score high in both trust and value. The way that they measured value was, again, 3 indicators. One was resource contribution. So what quality and quantity do partners contribute as far as resources? And then what dimensions of influence and power do they have, as well as what is their time commitment and level of involvement. And on the next slide, I would just like to run through a few conclusions that really stood out to us from looking at this data. And the first one is just, according to the stakeholders who participated, our early childhood system has not been very successful in meeting the needs of families. And we really identified the most critical goal as advancing collaboration and promoting collective impact, also noting that goal is the most likely to be achieved. The biggest barrier identified was lack of funding. And then the greatest need that stakeholders identified for families was that access to the affordable, comprehensive, high quality early education system. The high trust and value scores really stood out, and thinking about how we could leverage that trust and value of our partners in meeting that critical goal of advancing collaboration in order to improve the efficiency, navigability, accessibility, equity, and comprehensiveness of our state's early childhood system. And we also really thought about how this research was, just gathering stakeholders' perspectives. And so we really need to have future research that includes families so that we can identify their perceptions and goals as well. And so I just really am excited, I guess, about the data that points to that need for stronger collaborations that we can all leverage to affect change, because we do have so many existing resources. And of course, we have confines, policy, funding restrictions, things like that, that we all acknowledge. But we see a lot of opportunity here for working together. And now I would like to introduce you to our next speaker, Nadine. Nadine Cottrell is the Executive Director of Mississippi Families for Kids, and she's also a licensed master social worker.
Thank you, Kelly. So we have given a lot of information today as far as feedback from stakeholders, and we wanted to definitely include feedback from families. This is by no means a representation of the opinions of all families, but we did want to hear a voice from a family as to what our findings were. So I'm inviting Ms. Washonda Patton, who is a disability benefits program specialist working with the Mississippi Department of Rehabilitation Services in Madison, Mississippi. She helps those who, like her son, are receiving Social Security income benefits. While still new to the role, she enjoys helping others and loves to learn about different options that can benefit children, adults, and families in any way possible. Ms. Patton is the wife of Dontavius and mother of two beautiful children, as you can see, 7 and Xavier, and Xavier has Hunter syndrome. She is currently receiving respite services from Mississippi Families for Kids through a partnership with the Mississippi Department of Human Services and Help Me Grow. I invite you to help me welcome Ms. Washonda.
Well, it seems like we lost Nadine oh, there you are. Well, welcome, Miss Patton. Why don't we let you go right on?
Hello, everyone.
We're very glad you're here. And just whatever you want to share, we're looking forward to hearing.
Okay. So I am a parent working with the respite providers with Mississippi Family for Kids. And both of my children are a part of that program. Their grandmother is their caretaker that helps us out. I enjoy the services just because I feel like, number one, being a parent of a disabled child, we're not forgotten, that service is available and that we have someone that can, that we trust and that we can also, pay and, give them something, for helping us out in our time. I also really appreciate the services just because it's a good thing for families. Sometimes depending on if it's a single family home or, one parent is working a lot and the other staying at home taking care of the children, that you have the option to, go and do things and, have someone to, take care of your children for you while you run small errands or, get things done that are needed for the household or, for the children or for themselves as well. But I really thank the program. I'm very thankful and grateful for it. It has helped my family a lot, especially, my son, he has a lot of doctor's appointments and, sometimes I'm not able to get off work. Sometimes my husband isn't able to get off work. So it helps that, his grandmother is able to, go and do that and, have some gas money to take him to and from appointments. And I just really think it's a great service, great idea. And, those that really can benefit from it, I think they should know more about it.
You're really bringing home that idea of how important things that are just very practical that can be adapted to your family and that you can figure out how to make them work for you. Like it sounds like you picked your own respite provider and just how important it is that things be relevant to families in their real worlds. So
yes.
Are there any other thoughts that you want to share about any of this? I want to make sure you have all the time that you want. I also don't want to put any pressure on you to share more than you want to share.
I pretty much I was listening as the previous speaker, and I there's a program that Takeda, it used to be a Shire One Pad. They kind of help pay for because my son has to have infusions weekly, and it's a very expensive medicine. So that they help out, pay for that and get the services that he needs. So I was just speaking with the case manager, she was kind of checking in to see, what some things that, may could help not only myself, but, for other families. And I was kind of sharing those same exact things with her, just, the knowledge, the healthcare providers, the schools, and, more resources. So I agree with that as well. So I appreciate this.
Ms. Patton, I have a question for you. This is Susan Buttress. I'm a developmental behavioral pediatrician, and I know that your son's diagnosis is a difficult one to manage. When he was young and originally diagnosed, did you find that you were struggling to find services, or how were you able to find the services?
Well, his doctor initially, the doctor that diagnosed him, she kind of had everything kind of lined up. I went to her with my concerns. She, immediately did the testing. Once, we got with the geneticists and, they gave us a diagnosis, they kind of pretty much had everything, prepared and ready for us. They connected us with Shire One Pat, they got us in with was it First Steps? They kind of just had everything ready for us. And then as time went on and, we started seeing more providers, gave a little more, information or, would say, try this. So it was the providers.
So I think you're pointing out something that we all know, and it's having well-trained providers who know what the services are in the state and know where they are available to make sure you're connected. So I'm so happy to hear that you were lucky and that you encountered a good provider who could do that for you.
Yes. Thank you.
Sounds like that real, almost that medical home model. That's just wonderful. Thank you so much, Ms. Patton. And I think we're going to circle back to Dr. Buttress for a couple minutes, and she's going to add a couple of remarks, and then we'll go on to our next slide.
Right. Now that you've heard the survey, I just wanted to bring up a couple of things. One thing that the Child Health and Development Project has been working on, one very large thing, is working on a model, a system for early child health and development that's well connected so that children can be linked to services and have services that are appropriate. So some of the work that we've done, we've worked with National Help Me Grow that has the only evidence-based model for a system of early identification of developmental behavioral problems and then linkage to services. We've also worked in partnership again with SSRC on training modules for childcare, because we know how important it is for childcare providers to be well trained and understand early child development, early brain development. We have been working with looking into early intervention. We know there's some problems there. We know that there's some needs there. So trying to look at the barriers and what is going on. We also know that in some areas of our state that there are definitely not enough well-trained providers, not just physicians and nurse practitioners, but social workers, allied health professionals like speech therapists and occupational therapists. So we have established a fellowship program that's a postgraduate training program for social workers, psychologists, occupational therapists, speech therapists, and others to get some additional training. So I just want you to know where this project, along and joining in with others like Families as Allies and Mississippi Families for Kids, has also, we've been working together trying to look at the system and trying to make recommendations. And at the end of this year, this is our 5th grant year, we are going to write up a summative report that hopefully you'll all have access to soon once HRSA approves and all, which will be helping to make recommendations. So we're trying to join with other groups such as CCAC, also to try to start joining hands. One issue that Mississippi has long had is working in silos, doing great work, but not joining hands with others. So that's what we're trying to do. Anything we've done, you can have immediate access to. We are happy to share any and all. So like I said at the beginning, please go to the MississippiThrive.com website. We are proud of it and think it's a good one. We have links to others also. So I'll stop there. And Joy, are we going to questions next? Is that our plan?
We
Yes.
are ready for our discussion. So we do have some discussion, and I'm just pointing this out. So I think someone else may be facilitating this slide. We do have questions up here that we wanted to get your all's feedback on. And I forgot to say this at the beginning. You're welcome to respond to these in chat. You're also welcome to unmute and just share. And if there was someone who would prefer to be visible while you share, just send me a message and I'll promote you to a panelist so that you can be seen. But we're looking forward to y'all's feedback.
Kelly, I think you are facilitating the discussion. Is that right?
I can. I'm working on the raffle.
Oh, okay.
Could-
I'm happy.
We have Dr. Buttress down, but any of y'all can take it.
Okay. You're muted, Dr. Buttress.
Yeah.
There you go.
Yes. So again, I'm trying to watch. I'm getting my options, my view fixed. Sorry, guys. So we really do want you to tell us a little bit about what you saw. I know we moved through that pretty quickly. And so if you want to see any other slides that Heather went over, we're happy to re-show them to you. I do see a comment in the chat. Shawnee Cooley says, I think this data proves the need for early childhood education and early detection. And absolutely, I think that's one thing that resonated very well. Any other thoughts? And certainly anyone, please just let us know if you have any desire to unmute. Let's see, I'll read the next one. The Mississippi Early Learning Alliance is working on a collective impact initiative to hopefully create a productive framework for collaboration with a child care focus. Do you want to speak right now? Is that what you're saying? Okay, so maybe Chloe Lake, if we could make her a panelist.
I'm working on it. Let's see.
Okay, and while we're working on that, let me go to Dr. Tammy Brooks. She says, so I feel like many of these responses are no surprise to most all of us. What now do we do with this data is to increase funding and convince policymakers. Yeah, I think it's very clear that we need to engage with our policymakers, particularly our legislators and our governor and lieutenant governor, to convince them that that these children birth to 5 are the ones, they truly are our future. But right now, this is another message I just want to put out there for all of us. I think we need to remind the legislators, because children don't vote, that also it improves the lives of families, like our parent who just spoke to us, how much your life can be enhanced by having the support and the need, how it improves the lives of teachers and childcare providers to have adequate resources and services out there. So keep in mind, we're not talking about children, we're talking about all of us and the difference that it makes. So I will say we have policymakers out there who are really, really interested in this. And so I think this is an action time when we've gotten some traction. And I would encourage all of you on this call to contact your legislators and start singing this song all together. Okay, I think we have Chloe as a panelist. Chloe, so I'll turn it over to you.
Hi, and I can turn my camera on too if you would like to see me. Yeah, so thank you so much. I think first of all, this is great. Thank you so much for sharing this data. And I am lucky as part of the Mississippi Early Learning Alliance. We work with Mississippi Thrive and the Children's Foundation on this collective impact initiative that we're calling Forum for the Future. So I did get a bit of a preview of some of this data because it's really in line with what we're trying to do. And I don't know if some folks on this call may have heard about this already from Mela or been to our State of the State event in November. But during that time, during that event, we launched our goal, which is to, let me make sure that I get this right because it's long, but our goal is by 2030, Mississippi's childcare system will be state of the art, fueled by robust data, cross-collaboration, and resources to meet the needs of all children and families. So obviously that's big. And I think, but really something that's come up a lot in our conversations is just this recognition, as you guys have all said, that we have a lot of strong pieces to the puzzle in Mississippi, that there are a lot of things that are working independently, but they're not connecting. And we could be a lot stronger if we were working together. So I think where we are with that is with Mela and our partners and our backbone is that everyone recognizes that if collaboration were easy, it would already be happening. But we're trying to use a collective impact framework to create a sort of collaboration that will have an impact. So a lot of that sounds really jargony of collective impact, and without spending a ton of time getting into what that means, basically we're trying to create a structure to help stakeholders work together towards a common agenda. And our common agenda, again, as I mentioned, is going to be focused on childcare, which I know is only one piece of the early childhood system, but that's where we think we can have an impact, and certainly is a reflection of the findings of this study that access to affordable, high quality early education is one of the most critical goals. So I think in terms of next steps, and I know some of the questions in the chat were sort of acknowledging that there's a need for solutions or a need to move forward and figure out ways to de-silo. We will be creating a steering committee, which will help us determine the scope of this initiative and the overall direction of it. And then we'll also be, again, part of that creating a structure for collaboration will be to create working groups, which will then go out and implement different parts of this common agenda. So if that sounds exciting to anyone and you're like, great, where do I sign up? Unfortunately, I do not have that answer for you right now. We're working out the structure and the setup of that steering committee and those working groups. But I can drop in the chat our website, msearlylearning.org, so that everyone kind of can keep up with us. But yeah, I think we're really excited about that there's so much strong appetite in Mississippi for better collaboration, and that there seems to be everyone is in agreement that the system could be improved and that we could have better collaboration. So we're hoping that through this initiative, we can create an opportunity for that. And also we hope that folks will get involved, especially if they're interested in early education. So I will put our website in the chat, and also I'll put my email as well in case you guys want more information.
Thank you, Chloe. Thank
Yeah,
you. We
and-
appreciate those comments.
Sorry,
Yeah.
Susan, I was going to piggyback just a little bit on what Chloe said. I'm so glad you spoke up, Chloe, because that's been on our mind too. And I think these data really do point to so much of the work that's taking place with the Forum for the Future, of which Mississippi Thrive is a part, along with the Children's Foundation. And I guess just to clarify, so people don't get confused, we are talking about several system building efforts. And as Chloe just said, Mela is really taking on the early childhood education piece, and then the work that Mississippi Thrives involved with that. And then the work here that Susan was talking about earlier with Help Me Grow National Center and Mississippi Families for Kids and Families as Allies is focusing very much on a similar process to develop the infrastructure for developmental health. Now, these two efforts have to be extremely coordinated with one another because they're so interwoven and they're so tied together. And so we're making sure that that's the case along the way. So thank you, Chloe, for sharing that with us and putting that on the table as well.
Yes, thanks, Heather, for that. There's an anonymous attendee who put in the question box, what exact things are we asking policy people to do when we contact them? Can we get a list of ideas? In that is the way you become coordinated. And yes, absolutely. One thing that, first of all, we need to do is remind our legislators that to invest in children, in early child care, in early intervention. And so just to focus on kids and invest. But I think what we can do is, if you will, bear with us, instead of talking about the very specifics, I would like for us to have, I think we have everyone's email on this, for us to send out some recommendations. Right now, that is exactly what we are doing. We are working on very specific recommendations, where the deficits are, and where we need to focus. So we know that one of the big areas is in early intervention. We know another big area is better support for childcare. No question about that. And so those are some of the areas in which we'll be working on. I think, let's see, Kaylee says,
Susan?
Yeah.
Could I add just one thing to what you were saying?
Yes, absolutely, Joy.
Another thing we discussed is, it's always interesting with something like this. There's that balance between, you don't want to just say, this is what we found, now everybody go do this. And I don't think we would have done that anyway, because this is so interactive, and we have to know what everybody's thinking and let everyone be a part to the extent they want to be with what these findings are. So we did discuss that after today, and listening to people's feedback and giving you time, like afterwards, if you want to give us feedback, getting something back out to you with some ideas that synthesize the feedback we've gotten too. And this also occurred to me, just with where we are in the legislative session, that probably also means by sometime next week, maybe, or early the week after, we'll also have a better idea of what legislation is still alive at that point. And there may be a way to look at what's still alive as far as bills go, and things that have come out of this meeting, and how we could use the legislation that's out there, proposed legislation, to further some goals too. So we did have that goal of giving people more feedback over the next week or two as we send myself.
Thank you. Thank you for that, Joy. Yes, absolutely. Let's see, Kelly says Nadine and I have got the raffle sorted. Okay. I think we're ready. Let me read one more comment. Kaylee says, I'm so excited about the statewide work this data can impact. I feel going forward, what each of us can do right now is work to improve these relationships between early childhood providers where we live, so that we can have a united voice from each of our communities. Oh my gosh, that is so very important, for everybody to reach out to their own communities and start getting the word out that we want to be a united voice. But like Joyce said, I want to definitely reiterate that we definitely want your feedback. That's a big part of why this survey was done, so that we can hear from you, hear from people who are all over the state and who are experiencing the barriers and the difficulties, so that we can know where we need to intervene, help, make recommendations, and the like.
Can I ask a question?
Absolutely, go ahead.
I wanted to know what do you all suggest, as far as parents, what are things parents can do, to help, or who do you suggest that we talk to, or, things that we just do, to help get the word out, to help let pretty much everyone know that these are concerns, these are things that, need to be done, the barriers and, things like that. What are some things that we can do?
Does anybody want to start?
Well,
Joy, go ahead.
I would just start with and I'm a parent too. Parents can do, I would first start with parents can do whatever suggested for everyone. Parents can do those same things. If there's action alerts about calling legislators and all that, to do all those things you feel comfortable with. And if you want support in knowing how to do any of those things, that's one thing our organization does, is help families get involved in policy if that's something you're interested in. But also, parents have such a powerful tool because we have our story. And I'm not saying that you should have to go tell everybody everything that ever happened to your family, but just that lived experience of letting legislators know, I know for real what this is like, and I know for real how it is affecting my family. And that can bring home messages to legislators that sometimes data is wonderful, and we have to give them that too, but sometimes isn't quite as doesn't speak to them quite as much. So those were just two things that hit me from your question.
Man, the story, they love to hear a story. So Miss Patton, just like your story, talking about how those services enhanced your life. Talk about how, if there were services that were great and then they went away, how it affected your life. I think those kinds of things can make a much bigger difference than a pediatrician speaking about it for their parents. The policymakers want to hear from the people who live in their area. They really do. They don't want to hear from us all the time. They want to hear from those of you who are their real constituents.
Okay, thank you.
So shall we, I don't want to cut anybody off, but Dr. Brooks just gave a very good suggestion, a call to action for stakeholders that we can share with everyone, including parents. But I think, are we ready to move on to our raffle?
Yeah, Joy, can I say one more thing before we go to that? I would just like to let everybody know that we have our Mississippi Thrive Child Health and Development Summit. It's put on by this group that we've talked about, and it's occurring on March the 4th. There is an in-person and a virtual, and we'll send an invite to all of you. We would love for you, all of you to attend. It has CEU hours if you need it, but it's also for anyone, any stakeholder in early child, and that includes parents and other providers. So March 4th, you'll be getting an email about that too. All right, now on to the most fun part.
All
Callie?
right, thank you. So Kelly will put up our raffle wheel. We will be pulling names for 4 children's books, 4 developmentally appropriate toys, and 4 $25 American Express gift cards. So that's 12 opportunities to win. So once Kelly pulls up the wheel, we can go ahead and start pulling names. And as she's working on that, just a caveat, if you're a part of this Early Childhood Network partnership, we have removed your name from the list of eligible participants for the raffle.
Okay, thank y'all so much. I can see that I can control the screen, but I don't see an option to share. Because I wanted to show y'all this cool raffle wheel.
Do you see, you don't see anything at the bottom about new share? Looks like you're doing something.
Oh
Okay.
goodness. Did I do that? I'm sorry.
Okay, so you unshared what I was sharing.
Okay.
And there should be, do you see share at the bottom of your screen?
I don't. I'm sorry.
Okay, we may need to just do the raffle.
Okay. Well, it looks really cool. I'm sorry we couldn't show you. It's from wheelofnames.com, which Nadine showed me if y'all want to look it up and see. So I'm going to click the wheel to spin and I'll let you know the name. The first name that it stops on is Firefly's Note Taker.
Congratulations. If you can submit your contact information to our moderators, we will get your prize out to you.
Okay. And that one, that was for a children's book. It's like a set of several scholastic books. And so we have 3 other of those book packets as well. So I'll go ahead and do the next winner for a book packet. And this winner is Kathy Wilson. You also won a pack of Scholastic children's books.
Congrats.
And we have another Scholastic book packet winner who is Marion Minton. And then for the last winner of the children's book packets from Scholastic is Kanisha Bennett. And now we are going to spin, congratulations to all the Scholastic book packet winners. We're now going to spin for the a toy, children's developmentally appropriate toy. And the first winner is Charlotte Brister. Congratulations, Charlotte. The next toy winner is Asia McCoy. Congratulations, Asia. Okay, I see a question in the chat. The easiest way to, I think Nadine's recording all the winners and we have your email addresses from the Zoom registration. Is that right, Nadine? So do the winners need to do anything right now?
They keep doing it. Yes.
Okay.
Sorry.
Okay, thank you. So yes, Kanisha, we'll follow up with the winners via email and we will get your address from you or figure out a way to meet up with you to give you your prize. Okay, and then the next winner of the toy is Beth Fly. Congratulations, Beth. And y'all tell me, did we have 2 winners of the toys already or 1?
Beth is the third winner.
Okay, so this one is the last winner of the children's developmental toys, and that is Tammy Brooks. And our last prize, we have 4 gift cards, and these are $25 American Express cards. So spinning now for the first winner of the gift card. This is, oh gosh, and okay. It like just clicked to a different name on the wheel. Antoinette Selvey is the first winner of the gift cards. And the second gift card winner is Missy Hamilton. The third gift card winner is Jennifer Johnson. And this is our last winner. This winner is Dawn Vosbein. I probably butchered your name. And those are all of our winners. Thank y'all so much. And thank you, Kathy, for yes, sharing books with families. Absolutely.
Great. That's exciting. Congratulations to everybody who won. Thank you so much for being with us. And you will be hearing more from us, but we want to hear more from you. So I would, if you have any recommendations for our group, I'm again, Susan Buttress, sbuttress@umc.edu. It's easy to find me. And Families as Allies, Joy Hogue is easy to find also, Mississippi Families for Kids also. So I hope that, sorry, my sister's calling me. I hope that you will feel free to contact any of us in the future. And we really do hope that we get to see you at the summit. Joy, any last words?
I was trying to type everybody's, I don't know, Nadine and y'all from SSR, see if you want to put your emails in the chat real quick. I just want to thank everyone for being here and being part of this. And we look forward to hearing more from you and then sharing more with you. And you will be hearing from us in the next week or 2. But thank you for being here. I appreciate you.
Thanks so much. Hope to see you soon. Bye.
Bye.
Bye.